Project has met with neighborhood resistance, and before the city council votes on whether to approve it, a subcommittee held a hearing today. Our Marvin Scott was there.
We disapprove this project.
A city council subcommittee holding its final public hearing before the full council votes on whether to allow Northwell Health to go ahead with plans to build a $2 billion new modern Lenox Hill hospital on the Upper East Side. Even after the hospital redesigned the building, lowering its height, the community feels it will be out of character with the rest of the neighborhood. Simply, it's too high.
Further reduction in height causes us to have to think about what does a hospital no longer offer to the community.
Lenox Hill says the new building will modernize operations and house hundreds of private rooms. Neighbors are concerned the 9-year project will disrupt their neighborhood with noise and construction traffic.
The deadly combination of size, height, and build program will conspire to destroy a neighborhood at the expense of a grossly out-of-scale institutional expansion.
Critics of the project question the need for another hospital on the Upper East Side.
The Upper East Side has the highest hospital beds in resident areas in New York City. It is referred to as, quote, bedpan alley, and does not need any more beds.
I understand there are multiple hospitals that are on the Upper East Side, but there are many, many, many people who live on the Upper East Side equally, and we need to provide services to those people.
Local Community Board 8 has rejected the project. The City Planning Commission has approved it, as has Manhattan Borough President Mark Levine. Hospital officials indicate there could be some room to compromise.
We're going to continue to work with the community. We're setting up a task force to make certain their voices are heard. We're going to listen to them throughout the process.
We're going to sit down with the hospital and our council member, and hopefully we can come to an agreement. I think we can bring down the height, and I think we can shrink the mass. And I still think that we can get a modern hospital that the Lenox Hill will be proud of.
The community has spoken, City Hall has listened. After today's hearing, the City Council has less than 50 days to decide whether or not to approve the project. If it does sign off on it, then Mayor Adams has 5 days to decide whether or not he approves. At City Hall, I'm Marvin Scott, Pix 11 News.